home when I was 15 years old. There's nothing left to lose. There's nothing left to sacrifice. It's time for choosing, time for changing, time for rearranging. This was your life. I bruised the vein, I fell in love like a friend I used to know. I lost my mind, it said too many times before. I know I lost, I know I failed at what meant the most to me. This was my life. This was my life. Nothing left to give in. This was my life. Stories turn to lies. This last chance, no second tries, no second guessing. Try again some other time. You try again some other time.
Alright, hello everybody. I'm here to talk to you about addiction and my volunteer group, which is called Mentoring Angels, where we do peer interventions for people with drug and alcohol and other substance abuse that end up in the hospital. So when they're in a place, in Lexington, Kentucky, there are only 2 places for somebody to detox. If they've had too much or they're ODing but not dead on medications. If you're ODing on pain meds or heroin or something, then they'll treat you in the ER anywhere and then send you to Good Sam. You can detox from alcohol or benzos at Good Sam or the Catholic Action Center. Other than that, nobody's really going to take you, especially in the middle of the night when most of this stuff happens. So at Good Sam, you come in and you're admitted, and you can either go to the 4th floor where they hook you up to the IVs, or if you've had a suicide attempt in there, they'll put you on the 3rd floor in the behavioral unit. Now, before you get to the 3rd floor, I just want to let you know that alcohol withdrawal is very severe, and you can die from it. It takes about 2 weeks to get away from that. You can hallucinate and shake and everything else, and same with benzodiazepines. The people who withdraw from that, it's very painful. They're very miserable. It doesn't take quite as long, but you can die from it. There's serious complications. So a lot of times you'll be administered a low dose just to get you through it, and you're slowly tapered off the medication. At this point, and stress the need for sobriety. At this point, they're given a choice whether you are willing to accept talking to somebody about sobriety or not. And that's where my volunteer group comes in, Mentoring Angels. And they are basically just made up of volunteers who are in recovery themselves, who come in and talk to the people that are willing to talk to us. We can't see anybody unless they say they're willing to, because of confidentiality of the situation. And that's why I'm outside and not in the hospitals. We're not allowed to film in there or film the faces of the patients or the people that work with these people. It violates a thing called HIPAA. And I chose outside as the setting to be in, because when you're in jail or when you're in these institutions for drug addiction, or when you're even outside in public and your addiction, you don't really go outside much. You're holed up in your house with your shades drawn, and you're using and drinking, and just basically wasting your life away. So we come in, we have volunteers. The only requirement for a volunteer is 3 months of sobriety, a home group, and a sponsor. What that means is a home group is usually a group like AA or NA or other recovery-based things. There's a lot of Christian-based recovery groups out there, faith-based, I should say, and there's some other structured affiliated people, and most of them use 12 steps as a basis, and we'll get to that. I'll show you a copy of the 12 steps in this video, but the sponsor is one who takes somebody through the steps and guides them through what it really means. And basically the steps are designed for living, where you clean up the wreckage of your past. You take a nightly inventory to find out how your behavior is separated from your higher power, and you take that in the morning with meditation to just do better the next day. Now, a lot of people come out of this with a lot of insight and wisdom. They sound great, but by no means are anybody saints. But one of the requirements of sobriety in the 12 steps is that you carry this message of hope to people who feel seemingly hopeless. And you go into the hospitals and you let them know that there is a way out. And that's a requirement for your sobriety. You stay sober. They say that to freely to keep it, you've got to give it away. So you got to freely give what's been freely given to you. So these people come in with the intent of offering that message of hope to the people. But more often than not, when you sit down with a patient who's just attempted suicide or who's still withdrawing, in the detox unit, you're only there for 4 days. So if you're just starting your withdrawals, you're still going to be withdrawn when you get out. It's just the nature of the beast. There's not a lot of money going towards this. There's not a lot of sympathy or empathy for people under addiction, because people think, well, they made the choice to use, they did this to themselves. So you go in and you just reel with them and you let them know, I'm here to let you talk about this. But more importantly, we ask them, what are your plans after discharge? Most of them don't have a plan. They don't know what they're going to do. That's probably one of the reasons why they try to commit suicide or overdose in the first place, is because they're at a point where they don't know what else to do. So we offer them resources. Mostly it's long-term outpatient or long-term inpatient when they get out. Or we try to offer them phone numbers, meeting schedules, anything, just a bunch of resources for where they can go for when they get out, and what they can do, and give them numbers and websites, and basically get them to a point where they're a little bit not as foggy-minded, so that they can move on. Like I said, they're very scared. They don't have a clue what they're going to do. So that's why peer interventions, I believe, are so important. The statistics say when you have a patient in the hospital for addiction and alcohol abuse, if you just have a doctor tell them, hey, this is destroying your liver, or hey, you're going to get a blood infection, they don't. I mean, yeah. That's probably what they were told in high school in the DARE program, And then if you have the nurse follow up with it, that's a little bit better, because the patients seem to relate to nurses more as per evidence-based practice by the North American Nursing Diagnoses Association. But statistics show that when you include a peer intervention, that's called normal care, by the way. When a patient is given normal care and a peer intervention, there is a 64% success rate that the patient will not drink in the first 6 months after release, and the majority of those also do not drink for the next 6 months if they go to an AA meeting or NA meeting or receive some kind of support within the first week of release. So if you're talking about somebody staying clean for a year with a peer intervention that's followed up by group therapy, that's a pretty big deal. 64% is usually not seen in the hospitals. There's some more things that I'd like to talk about. The main director of Mentoring Angels, she is funded by the Chrysalis House, so she does a lot of work with women. We have a lot of women volunteers, and they are, pregnant women that are addicts, that are having a hard time, younger women, and so those places at the Women's Hope Center and the Chrysalis House get filled up with a lot of the patients that we end up seeing. A lot of the people, we do a lot of work at Chandler Medical Center. That's where the endocarditis patients from the dirty needle sharing and all that end up. So we have women that come in to talk to, and that sadly enough is the majority of the patients are drug addicted women, young mothers and other things like that. We do have a lot of alcoholic men on the 4th floor and 3rd floor behavioral units who've attempted suicide. There's a lot of drugs and alcohol mixed. And we have a lot of male volunteers from AA that go and talk to these gentlemen. Sadly enough, the heroin use in men in Kentucky has risen, especially with the crackdown of the pill pipeline to Florida. Now heroin is a lot cheaper and people are getting blood infections, and we do not have enough volunteers to reach these men. We've got a long road ahead of us because of the touchiness of the situation. A lot of people like to remain anonymous, so you don't get to see who the volunteers are, and it's not like we can advertise or put this out there. We just hope that there's people in recovery who end up hearing about us and decide to give of their time to come and talk to these patients. The program started from a basis in Louisville. A guy in Louisville started a thing called Something Angels, and he got a grant. He did a lot of research, and that's where our nonprofit is organized from. That place is no longer in operation up in Louisville, so we are the only one in the region. But the guy who started that is continuing peer intervention studies and trying to get and change legislation for how the disease of alcoholism and addiction is approached. So until then, there's people like me who are not only doing patient contact, but I am trying to help out with flyers, leaflets, organizing resource pages to hand out to our patients, and get people that are involved in the group therapies and the 12 steps a little bit more awareness of us, and to come in. It's a brief orientation. You come in 3 times. You're guided through your first patient contact. You got to fill out some HIPAA confidentiality stuff, and then you get a badge and you're able to visit in UK. Now UK is a little bit stricter, but right now that's where we operate at. So once you get through that, then you'll be able to, you'll be able to go into the other hospitals, talk to their administrators. The other hospitals like St. Joe, I do know, has a volunteer program where people talk to alcoholics. I don't know about the drug aspect of it. But from my thinking, if you can get 64% of the patients to leave there and not touch a drink or a drug for 6 months, that's a pretty big deal. So that's one of the reasons why I do it. Thank you.